Okay, let's unpack this. You shared this really detailed veterinary source with us, all about why our dogs and cats might be breathing fast or panting.
Hmm.
Now, for most of us, fast breathing in a pet just seems like, well, fast breathing. Maybe they're hot, maybe they're stressed.
Simple. Right. Hmm.
But as this source immediately shows us, it's anything but simple. What's fascinating is how something that looks like just one thing, a change in breathing pattern, can actually be a signpost pointing to potential issues in so many different parts of a pet's body.
Right.
So our mission in this deep dive is to pull out the crucial distinctions, explore the huge, sometimes surprising list of what could be going on, and understand how veterinary professionals approach unraveling this mystery.
Exactly. We're looking at a really dense piece of veterinary knowledge here, but we're going to distill it down to the most important nuggets you need to know to be a well-informed pet owner. And the first nugget is getting our terms straight, because surprisingly, panting and breathing fast aren't always the same thing to a vet. That's right. The Thorst defines tachypnea as simply an increased respiratory rate. Just, breathing more breaths per minute than is normal for that animal.
Okay.
Panting, on the other hand, has specific characteristics. It's described as rapid, shallow, open-mouth breathing. Think of a dog after a run on a hot day, that kind of thing.
Okay, so tachypnea is any fast breathing. Panting is a specific type of fast, open-mouth breathing. What's the critical difference that this source highlights?
Well, the really key distinction, and this is important, is that panting is usually not associated with impaired gas exchange, meaning the animal is generally still getting enough oxygen in and carbon dioxide out. Panting is often more about thermoregulation, cooling down, or maybe a response to pain or anxiety.
Right.
Tachypnea, however, often signals a problem with that essential gas exchange, where the body isn't efficiently getting oxygen or removing CO2.
Ah, that makes a huge difference. So it's not just the speed, but the purpose and the efficiency of the breathing that matters. The source briefly mentions the underlying control system in the brain.
It does, yeah. It reminds us that breathing isn't just automatic. It's controlled by a complex center in the brainstem that gets signals from receptors all over the body, sensing oxygen levels, CO2 levels, pressure, even irritation in the lungs. Both tachypnea and panting are essentially triggered by these signals, telling the brain, hey, increase the breathing rate for various reasons.
Got it. A complex system reacting to different inputs. Now, are certain pets more prone to these issues? Does the source point to any predispositions?
Generally, the source says tachypnea and panting can affect dogs and cats of any age or sex. So, pretty broad. But it does flag a couple of specific groups. Older, large breed dogs are more commonly seen with panting related to laryngeal paralysis. That's where the voice box doesn't open properly when they breathe in.
Okay.
And, perhaps less surprisingly, brachycephalic dogs are beloved flat-faced breeds like pugs and bulldogs. They're definitely prone to panting because their squished anatomy often causes upper airway obstruction.
That makes perfect sense. Okay, so we know what it is and who might be more likely to have it. What does it actually look like to a vet? The source talks about what an owner might notice versus what the vet finds on exam. What are some of those at-home clues?
Yeah, the source points out that historical clues from the owner are super important. If the underlying problem is in the lungs or heart, owners might report coughing or that their pet gets tired really quickly on walks, alongside the fast breathing.
Yeah.
If it's not a primary breathing problem, the other signs will point to the real issue, things like drinking and peeing a lot, or increased appetite, which could suggest, say, a hormonal issue like Cushing's, or maybe intermittent signs you might miss unless you're really looking closely.
So the fast breathing is often just one piece of the puzzle. What about when the pet is in front of the vet? What are they specifically looking and listening for during the physical exam?
Right, this is where the vet gets really detailed. They'll observe the breathing pattern. Is it that open mouth panting or more of a closed mouth tachypnea? Is there extra effort involved? Then they'll listen closely. And the source emphasizes listening not just over the lungs, but also over the trachea, the windpipe, up in the neck.
Why there specifically?
Because sounds heard near the neck, like snoring or gurgling, sounds called stertor, or a high-pitched squeak when breathing in, that's stridor. Those often point to problems in the upper airway, maybe the nose, throat, or the larynx, the voice box.
Okay, and sounds coming from deeper down in the chest.
Exactly. Listening over the lungs can reveal different things. Wheezes, especially when breathing out, suggest the smaller airways, the bronchioles, are narrowed.
Like an asthma.
Precisely. Or bronchitis. Then you have crackles, which sort of sound like, well, like Velcro pulling apart or Rice Krispies popping. Those suggest fluid or inflammation is actually in the tiny air sacs of the lungs. Could be edema, could be pneumonia. But, and this is tricky, sometimes the lung sounds might even be completely normal despite a serious problem elsewhere.
Wow, okay. That's tricky. What if the fast breathing is due to heart failure causing fluid buildup in the lungs? What are the clues then?
The source lists specific clues for that too. The vet might hear a heart murmur or an abnormal rhythm. The heart rate might be very fast. That's tachycardia. Or they might even hear an extra heart sound called a gallop sound.
Uh-huh.
More concerning signs are things like a low body temperature, pale gums, or slow capillary refill time. You know, when you press on the gum, the pink color takes a while to come back. Those suggest poor circulation.
And if the problem isn't the lung tissue itself, but the space around the lungs, the pleural space.
Ah, yes, the pleural space. If there's fluid or air built up there, it pushes on the lungs and it muffles the sounds. So the vet might hear diminished or muffled breath sounds when listening.
And is where it's quiet matter.
It does. Quieter sounds down at the bottom of the chest might suggest fluid, because fluid settles with gravity. Quieter sounds up top might suggest air and pneumothorax, because air rises.
Makes sense.
And if it's only quiet on one side, that could suggest something localized like a mass, or certain specific types of fluid like pus or lymphatic fluid. The source also mentions the vet might tap on the chest percussion, it's called.
Like a doctor does on a person.
Exactly. Tapping over fluid sounds dull, while tapping over air sounds more hollow or resonant. It gives more clues.
So even just listening and feeling gives a ton of information.
Absolutely. And they'll check for non-respiratory signs too, like we said, pale gums potentially indicating anemia, or maybe an enlarged liver they can feel if they suspect Cushing's, or even just checking for physical trauma like broken ribs.
Okay, that gives us a great picture of what they see and hear. Now for the big list, the why. The source provides this, well, extensive list of causes. Let's try and break them down, starting with those causes that result in that specific open mouth panting.
Right. For panting, some of the most common and relatable causes are things like pain, anxiety, or just being too hot, hyperthermia.
Yeah, we see that a lot.
Definitely. Then there are specific conditions like that brachycephalic airway syndrome we mentioned. Certain brain diseases affecting breathing control can do it. Cardiovascular issues like shock or high blood pressure or abnormal heart rhythms can trigger panting. Interestingly, some medications, the source specifically mentions opioids, can also cause panting as a side effect. Hormonal imbalances are on the list too, like too much cortisol from Cushing's disease or excess adrenaline from a tumor called a pheochromocytoma. Also, laryngeal disease, like that paralysis.
And that key point that's worth repeating for owners.
Yes. The source makes a point of saying panting can be a normal behavioral pattern in some dogs, especially when they're excited or after exercise. This is really crucial. Not every single panting episode is an emergency, although it's always worth noting if it seems excessive or out of context for your pet.
Okay, so that's panting. Now, tachypnea, the faster breathing, often linked to those gas exchange issues. It sounds like a longer and perhaps more concerning list of causes.
It certainly can be. The core triggers for tachypnea often relate directly to problems with oxygen or CO2. Things like low oxygen in the blood, hypoxemia, too much carbon dioxide, hypercapnia, low blood pressure, severe overheating again, low red blood cells, which is anemia, or the blood being too acidic, acidosis. All these things trigger the body to breathe faster to try and fix the imbalance.
Right, the body's trying to compensate. And then there are problems in specific locations that cause it.
Exactly. You can think of it anatomically. Starting from the top. Issues anywhere in the airway could be upper airway obstructions from inhaled irritants, foreign bodies, swelling, or even collapse of the windpipe. Then lower airway problems like inflammation, infections. The source mentions things like mycoplasma or even parasites, or the airways narrowing, bronchoconstriction. Then problems with the lung tissue itself, the parenchyma. That includes fluid buildup, edema, which can be from heart failure, what we call cardiogenic, or from other causes, non-cardiogenic edema. Also infections like pneumonia, bleeding into the lungs, or sadly, cancer.
You mentioned blood clots earlier.
Yes, that's a really important one the source highlights. Pulmonary thromboembolism, or PTE. That's a blood clot getting stuck in the blood vessels of the lungs. It severely impairs gas exchange and causes tachypnea.
And things can make pets prone to those clots.
That's right. The source lists several conditions that increase the risk, including certain immune system problems that attack red blood cells, diseases causing protein loss from the gut or kidneys, PLE or PLN, also heart disease itself, cancer, and heartworm disease.
Wow.
Fluid building up around the heart, pericardial effusion, can also cause tachypnea by restricting the heart.
Wow, so something like a gut issue or a kidney problem could indirectly lead to fast breathing because it increases the risk of blood clots forming and ending up in the lungs. That's a surprising connection.
It is, and it really drives home how interconnected everything is in the body. It's not always just about the lungs.
Okay, what else?
Other causes include problems in that space around the lungs, the pleural space, so fluid or air, like we discussed, or interestingly, significant abdominal issues.
Like a really big belly.
Yeah.
How does that cause fast breathing?
Yes. If the abdomen is severely distended, maybe from enlarged organs, fluid, which is called ascites, a large tumor, or even just pregnancy or severe obesity, it pushes forward on the diaphragm. And the diaphragm is the main muscle of breathing. If it can't move properly, the lungs can't fully expand, so the body breathes faster, taking shallower breaths to try and compensate for that reduced lung volume.
That makes perfect sense when you explain it like that. Any other systems involved?
The source mentions certain brain diseases if they happen to affect the respiratory control center, like compression or maybe a small stroke near that area. And importantly, metabolic acidosis. This is where the body's overall blood pH is too acidic. This can happen with conditions like uncontrolled diabetes, specifically diabetic ketoacidosis or DKA, or severe kidney failure where toxins build up, or even severe diarrhea causing bicarbonate loss. The body tries to correct the acid imbalance by breathing off more carbon dioxide because CO2 forms carbonic acid in the blood. So, fast breathing, tachypnea, is the result. So if we kind of connect all this to the bigger picture, you can see that changes in breathing are far, far more than just a lung problem.
Great.
You know, anemia, obesity, a belly full of fluid, diabetes, hormonal imbalances, blood clots that started somewhere else entirely, they can all show up as faster breathing, which raises, the critical question. Faced with this enormous list of possibilities, how on earth does a vet figure out which one is actually happening?
That is truly the challenge, and the source gives us a peek into that investigative process. It starts, as you said, with that differential diagnosis list, where the vet considers the most likely culprits based on the history and the physical exam findings.
Exactly. And that physical exam is so crucial for narrowing it down initially. We already talked about listening to the chest tearing wheezes versus crackles immediately points the vet down different paths, right?
Right.
Listening over the trachea versus the lungs helps differentiate upper versus lower airway issues. And figuring out where breath sounds are quiet helps identify fluid or air in the pleural space.
Okay, so the exam helps prioritize. Then come the tests. What are some key things the source says standard lab work blood tests, urine tests can reveal?
Yeah, the basic CBC, biochemistry panel, and urinalysis are surprisingly informative here. Anemia itself, found on the CBC, can be a direct cause of tachypnea because there aren't enough red blood cells to carry oxygen efficiently, so the body breathes faster to compensate. A certain pattern on the white blood cell count might point to infection or inflammation, maybe suggesting pneumonia or pyothorax, which is pus in the chest cavity. High numbers of a specific white cell, eosinophils, might suggest allergies or parasites in the airways. Even high platelets can be a clue, sometimes linked to Cushing's, which predisposes to blood clots, or even iron deficiency.
What about the chemistry panel?
Lots of clues there, too. Certain electrolyte imbalances, like a low sodium to potassium ratio, can be seen with fluid buildup in the chest or abdomen. Liver enzyme changes, like high ALP, can point towards Cushing's. Low protein levels or protein in the urine could indicate those protein-losing diseases that raise the risk of blood clots. High kidney values suggest kidney failure, which can cause tachypnea due to toxin buildup or acidosis. And crucially, high blood sugar, sugar in the urine, and ketones in the urine are the hallmarks of diabetic ketoacidosis, a major cause of tachypnea.
So even tests not directly looking at the lungs can be the key.
Absolutely. And depending on their suspicions, they might run more specific tests, fecal exams for parasites, tests for internal function if Cushing's is suspected, or analyzing any fluid they drain from the chest or abdomen. Testing for specific infectious diseases like heartworm, FeLV, or others might also be needed.
What about directly measuring how well the body is oxygenating? You mentioned that earlier.
Right, that's where blood gas analysis comes in. Often they'll start with a pulse oximeter, that little clip on the tongue or ear, which gives a quick estimate of blood oxygen saturation, says PO2. Ideally, it should be 95% or higher.
Okay.
For more detail, an arterial blood gas test is done. This involves taking a blood sample directly from an artery, usually in the leg or foot, and it measures the precise levels of oxygen, PaO2, and carbon dioxide, PaSO2, in the arterial blood.
And what do those numbers tell you?
Well, a low PO2, generally below 80 millimilli Hg, confirms hypoxemia, low oxygen. High PaxO2, usually over 40-45 millimilli Hg, means the animal isn't ventilating properly. They're not getting enough CO2 out. This could be due to airway obstruction, problems with the chest wall muscles, pressure from the abdomen, or even just respiratory muscle fatigue from prolonged effort.
And low CO2.
Low CO2, hypocapnia, means they're hyperventilating, blowing off too much CO2, which can happen with pain, anxiety, or sometimes as compensation for metabolic acidosis. And speaking of acidosis, the blood gas analysis can also directly measure blood pH and bicarbonate levels to confirm if metabolic acidosis is the primary driver of the fast breathing.
The source mentions a ratio, PaO to FiO2. What's that about?
Ah, yes, the PF ratio. It's basically a measure of how efficiently the lungs are doing their main job, transferring oxygen from the air the animal breathes, the FiO2 fraction of inspired oxygen, into the blood from the PF. A normal PF ratio is high, like 500 or more. If that ratio drops significantly, especially below 200, it strongly suggests a problem with the lung tissue itself, the parenchyma, like severe pneumonia or edema. It tells the vet the lungs themselves are failing at gas exchange.
Got it. A lower score means the lungs aren't doing their job well. Okay, what about imaging? X-rays, ultrasound, those seem crucial.
Absolutely fundamental. Cervical and thoracic X-rays, radiographs, are often one of the very first steps after the exam. They can show if there's fluid or air in the chest cavity, reveal patterns in the lungs that look like pneumonia or edema, show if the heart is enlarged, or spot obvious things like masses or broken ribs. Different patterns on the X-ray can even help distinguish if fluid in the lungs is more likely from heart failure versus other causes, like cardiogenic edema often has a specific distribution pattern.
And ultrasound, when is that used?
Thoracic ultrasound is becoming much more common. It's great for quickly identifying if there's fluid or air in the pleural space, much better than X-ray sometimes, and it can help guide draining it safely, thoracentesis. It can also pick up certain signs in the lung surface itself, like artifacts called comet tails, suggesting certain lung issues.
And heart ultrasound.
An echocardiogram, yes. That's vital if heart disease is suspected. It directly assesses heart muscle function, valve problems, looks for fluid around the heart, and can sometimes show indirect signs supporting a blood clot in the lungs, like high pressure in the pulmonary artery. Abdominal ultrasound is used if abdominal distension or organ problems are suspected contributors.
The source mentions even more advanced imaging, CT scans and things.
Yes, for trickier cases. Fluoroscopy is like a live-action X-ray movie, really useful for seeing dynamic problems, like if the trachea or airways are collapsing when the animal breathes or how the diaphragm is moving. CT scans give incredibly detailed 3D images of the chest, finding subtle lesions that X-rays might miss, like small nodules or complex airway disease. The downside is they require general anesthesia, which carries risks in these patients.
Right.
And then there are specialized tests like pulmonary angiography or nuclear scintigraphy, which are sometimes used specifically to diagnose or rule out those pulmonary blood clots, PTE, though they aren't available everywhere and also require anesthesia or specialized facilities. And, occasionally, if a primary brain issue is suspected, CNS imaging like MRI might be needed.
It really sounds like peeling back the layers of an onion, trying to find the core issue. And there are procedures where they can actually look inside the airways.
Right. Procedures like laryngoscopy or bronchoscopy involve using a small, flexible, or rigid camera to visualize the voice box and the airways directly.
What can they see?
They can assess how well the larynx is functioning, look for foreign bodies, masses, inflammation, or signs of collapse. Importantly, they can also collect samples biopsies of abnormal tissue or fluid washes from deep in the lungs, called a bronchoalveolar lavage, or BAL, for culture or cell analysis. And as we mentioned, thoracentesis is the procedure to sample or simply remove fluid or air from the chest cavity to help the animal breathe and get a sample for testing.
So after this potentially very comprehensive investigation, the vet hopefully has a diagnosis.
Yeah.
How do they approach treatment then?
Well, the source is absolutely crystal clear on this, and this is probably the single most important takeaway regarding therapy. Treatment depends entirely on the underlying cause.
Right.
You cannot effectively treat fast breathing in isolation. It's just a sign. You have to treat why it's happening.
Makes total sense. Given the sheer number of potential causes we just discussed, are there any general support measures used while they figure it out or start specific treatment?
Yes, definitely. In critical cases, these animals need inpatient hospital care. Often, the very first step is administering oxygen therapy. This helps tremendously if low blood oxygen hypoxemia is part of the problem. In fact, seeing if the fast breathing improves significantly with oxygen can be supportive evidence that it's a primary respiratory issue.
How do they give the oxygen?
There are a few ways placing the animal in a sealed oxygen cage using small tubes that sit just inside the nostrils, nasal cannula, or sometimes just holding an oxygen mask near their face, though that's less efficient. For longer-term oxygen use, it's important to humidify it so it doesn't dry out the airways.
Okay, and then specific treatments for some of the conditions we discussed, like if it's an upper airway obstruction.
Right. If it's an upper airway obstruction, like in a brachycephalic dog having a crisis, sometimes mild sedation can help reduce their panic and the effort of breathing, which can worsen the obstruction. Managing body temperature is vital if they're overheating from the effort. In severe cases, the airway needs to be secured immediately, either by passing a breathing tube, intubation, or sometimes even performing a temporary surgical opening in the windpipe, a tracheostomy. If there's a foreign body, it needs removing. And often definitive surgery is needed later for conditions like laryngeal paralysis or severe brachycephalic airway syndrome. Anti-inflammatory medications might be used to reduce swelling in the larynx.
What about for lower airway issues like severe bronchitis or asthma, especially in cats?
There, bronchodilator medications are key drugs that help open up those narrowed airways. Oxygen is usually needed too, and systemic corticosteroids like prednisone are often essential to reduce the inflammation, particularly in cats with feline asthma where bronchoconstriction is a major feature.
Okay, and for problems in the lung tissue itself, like pneumonia or fluid?
Oxygen is again essential. Antibiotics are the mainstay for bacterial pneumonia. If there are underlying blood clotting issues causing bleeding into the lungs, those need to be addressed. For fluid in the lungs due to heart failure, cardiogenic edema diuretics like furosemide are critical to pull off the excess fluid. For severe non-cardiogenic edema, if oxygen alone isn't enough, sometimes more advanced support like positive pressure ventilation, basically a ventilator, might be required.
And if it's fluid or air around the lungs, in that pleural space?
The immediate step is usually draining the fluid or air via thoracentesis. This allows the lungs to re-expand, providing often dramatic relief. If the fluid or air keeps building back up quickly, a chest tube might be placed surgically, which allows for continuous or repeated drainage over several days.
What about those non-respiratory causes,
Yeah.
like the abdominal distension or metabolic issues?
The treatment focuses squarely on the primary problem. So draining abdominal fluid, sites for comfort, and to relieve pressure on the diaphragm, relieving gastric distension if it's bloat, managing diabetes with insulin, treating anemia with transfusions if needed, addressing hormonal imbalances like Cushing's, and so on.
Makes sense.
Yeah.
What about ongoing care, things owners might need to do?
Good nursing care is vital. Monitoring body temperature is crucial, as getting too hot, hyperthermia, makes breathing difficulty much worse. And if obesity is identified as a contributing factor, especially by restricting diaphragm movement, then a weight loss plan becomes an important part of long-term management.
The source also touched on surgical considerations, especially regarding anesthesia. What's key there?
Yeah, it emphasizes that patients with significant respiratory compromise are inherently high risk for anesthesia. Vets need to have a very careful plan. This often involves pre-oxygenating the patient, using anesthetic drugs that have minimal impact on breathing, and being prepared for rapid anesthetic induction, and securing the airway very quickly with a breathing tube.
Especially if an upper airway problem is suspected. Right?
Exactly. For suspected upper airway obstruction, they need to have various sizes of endotracheal tubes ready because swelling or anatomy might make intubation difficult. If surgery is planned to correct something like laryngeal paralysis or brachycephalic syndrome, sometimes it's performed relatively quickly once the diagnosis is confirmed and the patient is stable enough. And importantly, owners need to be counseled about potential post-operative risks, like the increased risk of aspiration pneumonia in dogs with laryngeal disease even after surgery.
So wrapping this all up, what does this mean for us as pet owners? We started with what seems like a simple observation: my pet's breathing fast. And this deep dive has just revealed this hidden world of potential causes. It's incredible.
It is.
From things that seem straightforward, like anxiety or being a little overweight, to really complex issues like heart disease, blood clots traveling from elsewhere, systemic metabolic diseases like diabetes. The list just goes on.
Exactly. And I think this reinforces the absolute key takeaway from this source. You simply cannot and should not try to guess why your pet is breathing fast, especially if it's persistent or seems different.
Mm-hmm.
As the source lays out so clearly, the investigative process vets undertake isn't just random testing, it's a systematic approach, using the history, the physical exam, lab work, imaging, all to pinpoint the actual underlying problem. And only once that correct diagnosis is made can the appropriate and sometimes life-saving treatment be given. It's not about treating the sign, it's about treating the disease.
That's such a critical point. The sheer diversity of causes really underscores why seeking veterinary attention is so important. If you notice changes in your pet's breathing, especially if it's not just, that typical panting after exercise or when they're excited. We've learned that panting, often behavioral or heat-related, is physiologically different from tachypnea, which is more often linked to compromised gas exchange or a significant underlying disease.
Yep.
The causes are incredibly varied, spanning almost every body system. And a thorough veterinary workup is absolutely essential for getting an accurate diagnosis and, therefore, effective treatment.
It's truly remarkable, isn't it? How much information a vet can potentially glean from observing and investigating something as seemingly simple as a change in breathing rate or pattern.
It certainly is. It's been a really, really insightful deep dive into a critical topic for all of us who care for pets.
And maybe a final thought to leave people with. Consider this, knowing now that something as seemingly simple as a faster breath rate can be a sign of conditions ranging from straightforward anxiety all the way to life-threatening blood clots or heart failure. What does that make you think about the importance of observing even subtle changes in your own pet's day-to-day behavior and physical state?
That's a powerful reminder to be observant and proactive. Thank you for joining us for this deep dive.